Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do when you have failed a medical coding exam and how to come back from it. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So disclaimer first. If you are extra sensitive, you might want to not watch this video today because of the simple fact that I am a very blunt person. I'm going to tell you what you don't want to hear and what you don't really want to know. But it's only to benefit you because underneath it all, I want people to succeed. The health information industry, medical coding, means so much to me because it's so important. We manage this data from patients, and all of these patients each have a unique history, a unique situation, and everything that we select is what they're going to get billed for. Okay, so we have to be right. And for these doctors, the work that we do for them to make sure that they get credit for all the work that they're doing. For these facilities, we are responsible for a lot of this revenue that's coming in. This revenue that is used to pay for staff, to keep people employed, for all the way from the front desk check-in to the custodians of the hospital to the kitchen staff, nurses, everybody, technicians. All that money comes from money that is generated by these providers who see these patients based on the codes that we select. So do I get a little excited when I start talking to medical coders about studying medical coding and what you have to do? Absolutely. The way that I say it, a lot of people don't like. And not, you know what, it's fine. It's fine with me because the ones that have listened and have gone and done the things that I've suggested, they've come back and told me, Blue, I could not pass before I found your videos. And now that I implemented all the things that you told me to do, I was able to pass. So that's what I want for you all in the long run. Okay? I'm going to read this message that inspired today's episode. But again, if you get extra sensitive, please just don't even watch this video because you're never going to change how I give this message. The only thing that you can do is change how you perceive what I'm telling you. And if you listen and you implement these things instead of going against and coming up with excuses and you have all of these things and blah, blah, blah going on, if you try it, you might be pleasantly surprised at the results. So let's get into it. So the viewer said this. There was two different messages. So the first one was this. Dear Blue, I have been studying and to no end, I still am taking too long on my questions on the CPC exam. And then at the end, I don't have enough time for my cases. I got a 44 on my first exam, 44% on my first exam, and I got 38% on my second failed exam. On both, I am positively upset and I feel like I'm running in place with no money to pay a tutor. I love my books. I do not tab. I have a big desk and I've gotten 100% on my anatomy and medical terminology, but bombed out on my ICD-10 CM and E&M, my 1 through 9 series, and flip-flopping percents on all the practice exams. I just need some more support. I am feeling at a loss. The same person also posted a shout out to all the hard workers who did not pass their exams the first time. You are not alone. Please raise your hand if you're like me. I will high five you for being courageous and never giving up. We can succeed and become a part of the workforce together. I am a scholar. I just learn differently. There are many learning styles. So here's the thing, guys. I came up in a time where not everybody gets a trophy. You have to compete for trophies coming up, okay? Because I'm Gen X. All of a sudden, later generations, it's all about the participation trophy. Everybody gets a participation trophy, and you participated, so everybody let's celebrate. Okay, here's the thing about that. Everything that you do, from your positive speaking to your negative speaking, your brain is paying attention. And this is very critical to a person who's studying for medical coding or medical billing and coding. It is very important because these exams are tough. Doctors have failed these exams. Nurses have failed these exams. So if you're coming in with no background in medical, don't worry. I mean, even people who are educated in the medical field still fail these exams. Providers still have a hard time understanding what we're even saying when we are talking about coding. But here's the thing. This sounds to me, now I don't know this person personally, I'm not responding to this because I have 1,300 videos where I talk about like the study tips and everything. I'm very glad that they obviously did really, really well in medical terminology and anatomy, but that doesn't mean a hill of beans if you are not practicing the coding. Now I have said bare minimum, when you are studying for medical coding, all through your program, you are supposed to be studying for 20 hours per week. There's no excuse. Family, no family, kids, no kids, 100 animals, no animals. You can squirrel in 20 hours per week. Well, how can you do that? 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes on your drive home or in the afternoon. And then you have 1 hour and 1 hour of study. That's 3.5 hours you've done in one day. You do that in 5 days, that's 17.5 hours. And then you have 2.5 hours on the weekend. That's where you start. That's where you start. Is you say, okay, Blue, I'm going to commit to these 20 hours. I failed my test. I have to take it again, but they're going to give me 3 months. You take those 90 days and you study those 80 hours per month. That is 240 hours of study at the end of those 3 months. And you tell me the difference when you're walking in there after you've done all these 240 hours of study, these 80 hours per month, and tell me how different you feel walking in there. Tell me how much more confident and how much more faster you're going to be with the books. This person to me does not sound like they were spending 20 hours per week, because if you did, you would not have scored lower. Started out with a 44 and then went down to a 38. That would not have happened. And then the other thing is this. If you're failing the exam and then you're taking it just as soon as you can, just as quick as a cricket, and then all of a sudden you fail again and now you don't understand why. You have no business taking a test so quickly. If you fail, you need to be giving yourself the breathing room to be able to take the test again. Don't be trying to take it like, oh, well, I'm going to take it next week. That's ridiculous. You failed it, and you failed it badly. This wasn't like, okay, well, we got a 79 and we almost, or 60, what is it, 68, 69, and then 70 is a passing score. It's not like you scored like that. No, you scored 44. What were you thinking? That you were going to be able to go in there and, oh yeah, I should be able to make up all of that in between? No, you need more practice. If you failed, you need more practice. If you got a 68 or 69, you need to be practicing, and you don't need to be taking it within 30 days. Now, if you have like a time limit, I understand that, but you need to make sure that you have as much time as you possibly can, but no more than 90 days, okay? No more than 90 days. So now you have a plan. You're starting off with 20 hours per week, and you have to commit to it. You have to commit to those 20 hours per week, because this, I ran out of time. This is somebody that's not practicing the coding. You're trying to do process of elimination, and that's not going to help you. Why? Because process of elimination is only supposed to help you on the subjects that you really don't understand. Like maybe there's a specialty that you really don't understand, no matter what you did during the school time and no matter what you did during the practice, you just couldn't get it. Maybe it's cardio. So what you're going to do is you're going to select the best possible answers that you can for those cardio scenario questions, if you don't know how to look up the code or whatever the case may be. But you don't need to be sitting there trying to guess your way through, and that is a problem, because there's a lot of schools that do push that, a lot of programs. Oh, we teach you process of elimination, and we're just trying to get you to pass the test so that you can go out there. So that you can go out there and be incompetent, so that somebody out there has to sit there and train you. That's the part that the schools are supposed to be doing. That's why a lot of these employers don't want to hire new people, because of that reason. Because They know that a lot of these schools did not hold up their end of the bargain. And a lot of these students are coming out here not understanding what they're getting into, which leads me to, a lot of people will say, Bleu, I don't like your message. I don't like you because of this and XYZ. Do I care? No, because of all the thousands of other people that I've helped over the years that I've had this channel since 2018. So please, those little tiny voices, please, Peanut Gallery, go away. Because I will continue to put my messages away because some of you need to hear it. Everybody's too interested in coddling feelings. And like this person says, raise your hand if you failed just like me. We're hard workers. No, my darling, you did not work hard. You may feel like you worked hard, but you didn't. Because if you did, you would have passed that exam. You would have gone through my videos because obviously you're on my channel. You commented. You've seen my posts all over social media because you follow me on 2 platforms. I know for sure. You would not have failed so badly if you had listened to my advice, but you didn't. I can be honest about that. You need to be honest with yourself. If you failed like this, if you failed with a very low score, you know you did not put in enough time. Or if you're trying to cram in a bunch of time all in one sitting, that's what's stressing your brain out. This is why I stress when I'm talking about this, when I'm talking about the importance of study and making sure that you squirrel away that time, 30 minutes at a time or 1 hour at a time. You take a break because your brain cannot process after that 1 hour. You will get tired. You will feel fatigued if you continue to study. And for those of you that want to get fresh and say, oh, I studied for 4 hours and I didn't have a problem. Well, that's good for you. And there's some people that may be able to do that. But for the rest of us that live in the real world and have all of these things on our plate, we need those breaks. So that's something that you have to do for yourself right there. Now, I do have the study challenges. Okay, I have those. They're the worksheets that you fill them out. It's 80 hours when you color in all those things. It's kind of like a savings tracker. Okay. If you want to order them from me, you can find the information in the description box below. But I made these so that way all you have to do is color them in based on the times that you did, the 30 minutes or the 60 minutes. And by the time you fill up the whole sheet, that's 80 hours that you've done in a month. And you stick to that 20 hours per week, still giving yourself a day off here and there, you know, at least once a week. And sometimes if you have extra time during the week, you can certainly add on a little bit more time so that way you can have the weekend off. Okay? If you can stretch that 2.5 hours over the week, maybe you have a day off from work and you can put in a little bit more time. But you need to be working with the workbooks. There's 2 workbooks that I recommend that they're in the description box below. That's the Nellie Leon Chisholm book. That's the ICD-10-CM and ICD-10-PCS coding handbook with the answers. If you are taking a CPC exam, you can skip all of the ICD-10-PCS questions and just study the ICD-10-CM questions and scenarios because they have them all through there. And you do that, you look up those codes, you cover up those answers because the answers are in the book and it'll explain to you, some of them, why. Some of them will just give you the answer. But you work with that workbook. That is the most comprehensive workbook I have ever seen. And I'm a book lover. I love books. But that is the best hands down book for learning ICD-10-CM and ICD-10-PCS. Then there's a CPC study guide. And that, again, I'm not with AAPC, but I will recommend that book all day long because it's good for coders. They broke down the CPT book the most fantastic way. They put everything in there in simplistic terms so that it's not so difficult to understand. You're going to go through there. You're going to cover up the answers. You're going to look up the answers in your book. Then you're going to apply those answers and see if you got the answers correct. Because I'm telling you, if you do that, you cover up those answers, those multiple choice answers, and you start looking up the codes yourself, you're going to get faster. You're going to feel slow at first, but you're going to get faster. And once you get faster, then that's when you're going to start not running out of time for these tests. Okay? You're not going to run out of time at all. So it's 100 questions and it's a 4-hour exam for that CPC. That means you have 2 minutes and 40 seconds per question. Not all of these questions are going to take 2 minutes and 40 seconds per question. Some of them are going to, or you're going to recognize that right away, and you're going to be able to answer it very quickly, okay? But you're going to still have the time to be able to get through the case studies. And that's what you need. And you need to learn to pace yourself. So 2 minutes, 40 seconds per question. But again, if you've gotten comfortable with your books, and if you've gotten to the point where you're saying, okay, well, they're not tabbed and they're not written in, good. Because the tabbing, the writing, the highlighting, that is not going to do you any good. Anytime I see any of these people out here that they're showing off their books and they've got all this clutter all over, are you even looking at the book? Because you've got so much writing on that book that you can't even see the codes. Oh, you got to add this and tab this and do this. You still have to look at the tabs to know where you're going in the book. Unlike the person who's actually been using the book and practicing with the book and knows by feel where to go. And trust me, you do those 80 hours and you do those 240 hours, in those 3 months, you will know by feel where to go. I can't tell you how many times, even though I've taken tests many years ago, I can literally by feel open the book and be right where I need to be. And I've amazed some of my providers being able to do that. They go, how did you do that? The book wasn't even marked. And I'm like, it's just by feel. I am with these books every day. So there's nobody that knows these better than I do. But you have to be able to get like that. And no, it doesn't take all day long. You're not studying 24/7. You're only studying the 80 hours. And like I said, you can purchase the study trackers from me, or you can make your own study trackers, whatever you want to do, okay? But the thing is, you've got to get on those 20 hours. That's the secret sauce right there, because that's all your practice time. And you're looking up codes, and you're looking through your book, and you're getting familiar with it, where everything is. A lot of people say, oh, I get so nervous in tests because I froze and I forgot where everything was, because you didn't spend enough time with that book. Anybody who's spending those 20 hours a week with that book, they're going to know exactly where to go in that book. They're going to know exactly about the appendixes. They're going to know exactly about the front cover of the CPT manual that has all of your modifiers listed and what they mean, and where to find the appendix that describes them more in detail. They're going to know all of that. That's where you need to be. Instead of this Mickey Mouse feel of, oh, well, we're going to shout out to all the hardworking people. You don't know if those people are working hard. You're encouraging them to kind of stay in that mind frame of, oh, I am working hard. Again, it may feel like you are, but if you are not putting in those 20 hours per week, if you are not practicing like you should, if you're not listening to the guidelines or reading the coding guidelines to help you to become a faster reader, that's a problem. That's where you're going to get yourself messed up. You are not this scholarly person like you think you are. That's you building yourself up and giving yourself all of these kudos that are unwarranted. You have to earn things. You have to earn it. You're not earning it. You're spending all this time out here making these posts on social media. The ones that I can see. Because trust me, there's plenty of these people out there. It's not just this person. It's other people that I see too, crying and going on about how they can't pass the test and they don't know what to do. You followed me on LinkedIn and you don't know what to do? And in big bold letters on my profile on LinkedIn, it says I'm a YouTuber. I talk about medical coding. My posts, I'm talking about, hey, this show is going to air tonight on my YouTube channel. This and this and this. So you connected with me, but you didn't look at my profile? And you don't know what to do? I don't understand that. See, when I was coming up from this, it was in 2007, 2008. 2007, I was in the school. 2008, I got my certification, right? And so when I did, there was none of this. There was no creators on YouTube, or at least none that I could even think at the time, because there was none of this. And there's still nobody like me. But with that said, know this. If you're not studying, it shows. And then you out here trying to encourage people to, oh yes, we're working hard and we're going to give each other kudos. Kudos for what? You're celebrating failing? No, you don't celebrate failure. What you do is you stop and you take a second to look at what the heck happened. I failed a test. I'm a human being. Okay, I failed. You failed not once but twice. And you still running around here encouraging people. Oh, did you fail too? Okay, now you're trying to get more people to be involved with what you're doing. But let's look at this. If you have failed, you need to not say, oh, who else failed? Kudos, pat on the back for still sticking with it. No, what you need to be doing is saying, okay, this is where I messed up. I messed up on the evaluation and management sections. I messed up on the coding sections. So you know there's only a certain number of questions they have for evaluation and management, which is very low for the CPC exam. So why are you sweating that? It's the bulk of the coding that's got you in a problem. That's where you need to be. And as far as, oh, well, I don't have money for a tutor. That was one of the very first things a person said was, I don't have money for a tutor. Even though I am a tutor, I always tell you guys, hey, the table is big enough for all of us to eat. There's plenty of other tutors out there besides me. Now, I'm a little bit on the higher end on what I charge, only because I've got all of this experience and I've done a lot to help students, and they've been able to succeed because I've been able to get them tutored and get them going. So that's why I do what I do. You can pick anybody, okay? There's plenty of them on LinkedIn. You can even ask for a recommendation. But that, I always say that a tutor cannot help you if you're not putting in the time. So if you're not putting in the time, it's a waste of your time to get a tutor. Because when you're studying like you're supposed to, then you're going to have those worthwhile questions, those meaty questions that if you don't understand what it means and you can't find a mentor, because a mentor will help you for free. Okay, mentors are people who are out in the industry and who have experience and they're happy to help new people. That's a mentor, and they'll help you for free with the general question. But if you get with those people and they can help you, or if they can't, then you got to go find yourself a tutor. Then that's when you find yourself a tutor, because you've been studying, you know all the things, but it's just a matter of getting somebody to explain this one-on-one to you. That's what I do when I'm tutoring. Tutoring is not about, hey, let's give you this lesson and do this lesson, do this lesson. No, that's a teacher. Tutors is different. Tutors are going to clarify those questions that you have. So that way you can, when you're together, you can get this all sorted out. Not that you are out there trying to get the tutor to answer your questions for you. As far as like, okay, what is this answer to this question? Okay. It's about explaining it to you. But if you are not getting into that practice, into that healthy practice, and giving yourself those breaks in between, if you're not doing that, you're going to continue to have this result. If you're out there saying, oh, yes, I failed, and, you know, oh, I want other people to say that they failed too, because then it makes me feel like I have community. No, you need to be looking at, okay, this is what I did wrong. Okay, now I know I got to practice on this section of the CPT book. So there's all these chapters. So I'm going to sit on a Saturday or in the evening when I'm there with my family and they're watching TV, and I can sit there and I can look at my book. I can just look at my book, look at the pages, and start absorbing all of those things. And when the kids are asleep and I have the house is quiet, I can go ahead and start practicing for 30 minutes looking up these codes. And then I'm going to take a break, and then I'm going to come back and I'm going to work another hour on this. And I'm going to use my study tracker to help me to keep track of all of the time that I spent in here, so that I know that I'm making some progress, so that I can see that visual progress, instead of being so reliant to say, oh yeah, I'll do it. This way, like I said, that was why I did these. I made these visual trackers for my Patreons, so that way that they could see them. And it was very well received with my Patreons. I was very excited and glad, because that's something that can help you. Okay. And my Patreon channel, we do a lot of exercises. It's like coding exercises, ICD-10-CM, CPT, ICD-10-PCS. And I post a lot of exercises. All the exercises that I've ever posted, people who subscribe to my Patreon channel have access to. The minimum pledge right now is $15. And you get access to all that. There's anatomy quizzes, medical terminology quizzes. There's everything there. And you don't have to subscribe past a month. But that's something that you can get into if you feel like, okay, well, maybe if I have something else to like look at and to study and, you know, work with, that will help me. Once a month we have a study hall. Study hall is live and it's on Zoom, and we all get together. These are not recorded, okay? For everybody's privacy, it's not recorded. So you can just come in and you're a member of my Patreon channel, a paid member of my Patreon channel. You can attend this meeting, and then you can ask your question, okay? And then if you subscribe to some of the higher levels, there's time in there with me included, okay? So, I mean, it's entirely up to you, and during their study hall, you can bring your coding question there and ask. And that has, I mean, I've been doing study hall on Patreon for a little over a year now, and my Patreons love it. When they're there, they can ask questions, and sometimes they don't even ask questions. They just sit and observe. But a lot of times they jump in the conversation as well, which I love. I love when they do that because everybody gets involved. And sometimes people are not thinking of something in a certain way, and somebody else will ask a question, and then you're all learning from each other. And that's the beauty of the community that I've created on Patreon as well. So just something to know. It's just an option out there. Again, you don't have to subscribe every month. You can cancel it anytime, okay? But that's just another option out there for you. But guys, take this seriously and quit fooling around with making these posts on social media saying that, oh, I failed. All this time you sitting here posting, you could be studying your book. You could be reading the coding guidelines. You could be doing all those things. You could be watching videos on YouTube about HIPAA, about medical terminology, about anatomy through Crash Course. Crash Course is a very good channel on YouTube, and they have all the subjects. And any subject you ever wanted to learn about is on Crash Course, and I love it. And they have whole playlists. You can listen to it in a loop. You can literally listen to it, the whole playlist on a loop. And that's something that's that time in to be listening. And if you want to learn about HIPAA and all this other good stuff, they have a bunch of HIPAA channels. Don't ask me for a specific HIPAA channel because they all say the same freaking thing. Literally, they all say the same freaking thing. So you don't have to pick particularly one, okay? And again, that's all part of doing your research. But I'm telling you now that if you keep failing like this, quit announcing it to everybody. You need to get on those books and you need to be practicing. That's what you need to be doing, and not making these posts, not sending me these messages. And especially when you see that I'm a content creator on YouTube for medical coding, and then you go to my channel and then you see the study tips, the medical terminology tips, the anatomy tips, all of these questions and everything that I've posted about how to make studying a little bit easier for you. You're telling me you can't watch those? You know? So, but anyway, all of my contact information is in the description box below. All the links for the books that I recommend are also in the description box below. You do not have to click on the links, okay? They're Amazon affiliate links. I get a small commission if you do, and I really do appreciate that. But the title is there. You can use that title and go and find it wherever you need to. But as I've said, if you need a tutor, you can find yourself a tutor, but make sure that you are prepared. Make sure that you have been studying, so that way you're not trying to tell the tutor, okay, teach me. No, you need to be coming with your questions. There needs to be a whole list of questions that you're going to that tutor with, so that way they can help you and maximize the time that they have with you. Okay, just my advice anyway. So with that said, best of luck to you. Do not take that test after you failed it. Oh, I'm going to take it again in 2 weeks. You're going to fail it again. You will fail it again. You maximize that time that you have, the max amount of time that you can take in between tests, especially if you paid for the 2 tests with AAPC. You maximize that time that you have, and then you take your test. But again, you do those 80 hours, you do 240 hours in those 3 months, you will be a lot more confident, you'll be a lot more ready, and you'll be ready for that test. Just what I'm saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.